Welcome to this morning's webinar. Happy Friday. So we'll be covering off patient insights, so their search behavior online mainly. And this will help you grow your business online by understanding this. So as a recap, we did this seminar in May, and that was in Melbourne and Sydney, and this was off the back of that there was a lot of demand for people that weren't able to make it. So we're presenting now to make sure that you're all in the loop. Cool, so this morning's agenda, I'll be covering off the Google Micro Moments stuff that Joe Chick and Steve Roach from Google spoke about, and then I'll go into the new healthcare world, looking at the patient insights as well, and the HealthEngine technology and product solution that works around those insights. So firstly, it's really important to know that patients don't go online, they live online, and we don't go online, we live online. Most people are using their mobiles to access websites these days and to search for every query that they've got. There are now trillions of searches made globally every year on Google. That's a metric that is hard to comprehend sometimes. So it's evident that people are starting to use this as their one source of truth. And over half of those searches are happening on mobile today. So making sure that you're mobile friendly and that your patient journey on mobile is fantastic is crucial these days. It's important to note as well that the penetration in Australia for smartphone usage is 80%. I've got a slide here detailing other areas so you can compare yourselves. Australia is really up there, and so we need to make sure that we're able to meet that market's demand. People these days also now have what's called nomophobia. So it's a fear of being without your mobile device, power source, or a service area. So I know that I have a bit of a panic if I'm out of internet range, or if I've left my phone at home, I'll have to turn around to go get it. So it's very much another limb these days for us, and it holds all sources of information that we rely on every day. So it's very important how much a mobile has become part of our everyday solution. Now, Google has coined this term micro moments, which looks at the moments between the main events that are happening for people in their daily lives. So, for example, I'm ordering a coffee and I have a chat with my friend next to me as to why she's using a straw to drink her coffee. She says, I've just had my teeth whitened, and then that triggers me to check my phone to see if there's dentists available that do teeth whitening, or there's at-home kits that I can use for teeth whitening. And then all of a sudden my coffee's ready, and in the time that it's taken to have my coffee made and ordered, I've had a micro moment within that where I've looked for a dentist online. So it's all about those micro moments where we've had a trigger and we've gone to do something instantly, and that's using our mobile devices. How many of you find this a very familiar scenario? I know for myself, this is the first thing I do in the morning as well. I'm woken up by my phone's alarm, and then I go ahead and check the weather in the morning, so I know what to be wearing for the day, or if I need an umbrella. So this is the majority of people, this is how they wake up every morning. In fact, 150 times per day is how often, on average, we're using our phones. I know there's an app that you can download these days to tell you how often you are checking your phone as well. I'm a bit scared to see that, but you can find out exactly what your number is. So 150 times per day, people are checking in on their mobile to do lots of little tasks, or to purchase things, or to search for things, or to use their maps, or to check the weather, or to connect with their friends. So it's important to understand that there's a chance that you might come up in their micro moments that they need to do during that day, and that you could be amongst one of these 150 times per day that they're checking their phones. So these micro moments are broken into lots of little things like, where can I get treatment moments? So 77% of smartphone users have consulted their phone to find local health services in the past 6 months. So these are stats from Google. And 3.1 searches are conducted when finding a new health service provider. And what's really important to them is that availability, pricing, quotes, and directions are mainly their top things that they're looking for there. Another micro moment is, who can I trust moments? So recommendations from friends and family are usually always the top thing, so word of mouth. But then the next one is researching health service providers on search engines. Another micro moment is, I'm ready to book. So 43% of health service customers wish more businesses had mobile optimized sites. It's scary to note that there's a lot of people out there that don't have a mobile friendly website, and that it was very much a set and forget thing done in, say, the 90s or the early noughties. Times have changed, and Google very much prefers and favors the websites that are mobile optimized, because they're all about the patient journey as well. HealthEngine as well is all about the patient journey, and so all of our website as well and the directory is all mobile friendly for the patient use as well. So mobile has changed how we act and react in life. We're wanting more immediacy. We've got really high expectations because Google makes things easy, HealthEngine makes things easy, everything's at our fingertips. And patients are very much loyal to their needs these days. So people are more chasing what they're wanting rather than who they're wanting. So if they need a dentist today, sometimes they won't go to the dentist that they've been to nine times beforehand. They're looking for someone today that meets their needs. So 3 key pillars to succeed in a micro moment world that Google highly recommend is being there, being useful, and being quick. I'll show you some examples here of what they recommend here. Making sure that you've got that mobile friendly site. So make sure that you can go on to test my site on Google, that URL there, and you can test your website and see whether it's mobile friendly on mobile devices. And that will give you actionable feedback as well. So it's not just, yes, you're mobile friendly, it'll give you a full outtake of everything that you need to know for that. So now we're looking at other things that patients are requiring. So when they're looking on Google, they're looking for immediacy. And one of the top things is having Google AdWords connecting to customers in those relevant moments. So Google AdWords, I get asked a lot about how it works and why should I do it. So we'll cover that off now. So the benefits of having Google AdWords is you can target your ads to the relevant patients, you can control your costs, you can measure your success, and also you can manage your campaigns, which is what we do internally for you. But you've got complete transparency over this amazing marketing tool. So for those of you who are new to understanding Google AdWords, on Google search results, there's 2 sections. One is the organics results section, which sometimes you'll hear the acronym SEO, and that stands for Search Engine Optimization. and that's relating to organic traffic only, which is the bottom part here highlighted. The next is Google AdWords section, which is highlighted here, and that's where the paid search results appear. The impressions are always free, and it's a cost per click advertising mechanism, and it's also known as search engine marketing, SEM. So sometimes you'll probably hear that little term being thrown around as well. So that's where you're appearing if you've got Google AdWords. There is no way you can appear there if you're just relying on your organic website. And it's important to note as well, with Google AdWords, we've actually seen that there's been a 17% search growth overall in January to March 2017 compared to last year. 48% of searches on Google are coming from mobile devices. And in healthcare, there has been a 3% decrease in cost per click compared to last year, which is huge. Now, cost per click and a few other terms like that can be quite confusing. So I'm just going to go through the next few slides to help you understand Google AdWords and how it works. So there's something called ad rank, which is how you are able to decipher whether you're going to be in top positions or bottom positions in each Google search. And that's determined by your max cost per click that you're willing to pay and your quality score, which I'll go through shortly. So your max cost per click is the most you're willing to pay for that click when someone decides to click on your advert. For example, if you decide you're only going to want to pay $1.20, you'll never pay more than $1.20 per click. With Google AdWords for HealthEngine, we help manage all of your max cost per clicks and monitor that for you. So it's very hands-free for you, but just giving you an insight into how the Google AdWords actually works. And then the other factor, the quality score, is determined from click-through rate, which is how many searches are actually clicking on your advert. Ad text relevance, so how relevant your ad is to the actual search keyword, and your landing page quality. So also being mobile friendly, as mentioned before, but also do you mention everything that you say in your advert on your landing page? So if I say that I do orthopedics, do I actually have that on my landing page, and is it going to be a relevant user journey if I did click on that advert? So back to those 3 pillars that Google mentioned as well, being there. So make sure that you're there when they're on the go, on their mobiles. So that's being there on mobile searches. As you can see in this example, the mobile only shows the Google adverts at the top first, and you're going to have to scroll a fair bit to get past those. And you can see how much real estate on a screen that these take up on mobile. So with HealthEngine's Google AdWords, we use all the bells and whistles available for your Google advert, which includes all of these extensions, your location and directions, the ability to call online, and all of these site links as well, which you can see within the first ad. You can see the book online or call today, etc. So we really take up all the real estate available so that you get the most visibility. So a little bit of insight into the structure of those Google adverts as well. You can have site links, location links, and also call extensions. So making sure that you've covered all bases is very important. And the cool thing with HealthEngine being a premier partner with Google is that we're always up to date with the latest bells and whistles on Google Ads, and we make sure that all campaigns always make the most of everything available. Again, the other pillar of being useful. So we make sure that we use the call-out extensions, which is another free thing to add into your Google adverts that we do for you. And then also have structured snippets. So you can see here in the right-hand version what that looks like. And then the third and final pillar that they mention is being quick. So if speed thrills, friction kills. We've got to make it fast and easy for them to get from their search query through to booking with you. So 40% of customers will actually abandon a site that takes over 3 seconds to load. 29% of smartphone users will immediately switch to another site or app if it's too clumsy or slow. And 1 in 5 dissatisfied visitors will never return to a website where problems have occurred. So it's really interesting to make sure that your first impression is always a good one. Cool, so the second part of this webinar is just going to be covering off the new healthcare world that you guys are entering at the moment. And the HealthEngine technology and product solution that's available to help work around this. I've got some really interesting patient insights in here, so I hope that this section will also be highly valuable for you. It's really important to note that in healthcare, you guys have a very important job to do, and it's no easy feat that you guys have taken on. Your immediacy to get someone from a search query through to you is not only time-saving, but sometimes it is life-saving. So it is very important that you guys are acknowledging that you need to be in this new healthcare world and accessible. So I really appreciate that you guys are taking the time to get these patient insights and understand how better you can make your experience for patients. Now, my next slide that I'm going to show you can create a little bit of friction that people don't like to see, but remember that we're talking about the new healthcare world. So in this new healthcare world, patients are very much in control. Obviously, they're not in control of their total healthcare outcomes, but they're in control of how they get them and who they choose. So the WHO estimates that actually 70% of the entire world's population at the moment are walking around with one chronic disease at the moment, and a small portion of that as well walking around with 2 chronic diseases. So it's really important to know that patients are starting to become a lot more reactive with their healthcare, proactive with their healthcare, and not so reactive. Oddly enough, we're becoming more of a healthy society, and we take our health very seriously. Millennials are, aka Gen Y, are actually expected to live over 100 years, which means that there's going to be a lot of healthcare involved in making sure that Gen Y is serviced well and that they are able to book their healthcare easily and stay with you. So it's really important that we're going to be able to cater to these patients. Now, HealthEngine's not the one that's triggering this change in healthcare. It's actually companies like these, the convenience everything sort of companies. So I know I never thought that I'd be jumping in a car with a stranger or staying at a stranger's house, but these apps have very much changed the landscape of the world we live in today and made it all very technology focused and safe and secure. And healthcare is starting to move into this direction as well. So we're definitely not the start and the driver of this, but healthcare is definitely following suit, and the patients are voting with their feet with what sort of apps they're going to start using. And HealthEngine is very much this. With over 1 million users to HealthEngine each month, it's significant how people are starting to change their ways. Some patients' insights here. Once people are booking online, they're really going back. So 96% of this pie chart here shows that people are going to take a tendency to book online next time as well. There's a small portion where people have tried it and they'll continue to perhaps book with the phone, but there's a huge change in direction to moving to online bookings now. Now, in this new healthcare world, it's really important to note that competition is going to be fierce, and there are going to be winners and losers. The companies that make it more easy and accessible to find them in patient times of need are going to thrive in this. And the companies that resist this and take a bit longer to adopt to which methods patients are preferring are definitely going to lag behind then. So it's important to note now what sort of direction you want to take and whether you want to be a winner or a loser in this new healthcare world, and start to adapt to what patients are wanting. As competition is going to be very fierce, it is important to note that yes, competition are out there and take note of what they're doing, but also very much keep in mind your own game. Focusing on your own game plan is going to mean that you'll thrive to success, and making sure that you don't follow every single competitor's plan of attack because they may be down the wrong track. So very much take a look at what your patients are wanting, because they're the ones that you're going to need to make sure that they can find you and book with you and come back to you as well. So yes, be aware of what the competition is and what they're doing, but keep your own game plan in mind, and hopefully this webinar is going to help you structure a good game plan and then come up with your plan of attack that you can stick to. So 51% of people actually have a healthcare provider in mind when they start searching online. These are stats from Google, which is really interesting. And 11% of those people are swayed by another provider because they were much easier to find online. So I have a lot of people that come through to me and say, that's all very well, but I have a lot of patients already and we don't need to do anything. That's fine. It's interesting that actually your online marketing can be helping with your patient retention as well as gaining new patients. So keeping that 11% of your patient book is really important as well. It's also important to note that 2.8 businesses are considered on average, and then 1.8, so let's say 2, are actually contacted out of that search process. Now, if there's 2 businesses being contacted, you really want to be number 1, and also you don't want them to have any reason to want to contact one more business. So making sure that you tick off the next 3 factors that are most important are really important. So I'm keen to get you to think about what top 3 factors are most important to patients when they're searching. And those top 3, this is in order of rank, is availability, confidence in service, and price. So making sure that your times are available 24/7 for when their search is actually happening, and not saying, oh, I'll have to go back on and search in the morning during their business hours. I must make a note of that. Being able to book then and there is really important. Confidence in service, so making sure that peer reviews, patient reviews, etc. are all really positive. And if you can and are confident too, publishing your fees as well is really fantastic for patients to be able to help them make a decision. So why do patients use HealthEngine? We've done a lot of surveys and we've found that patients actually really want transparency and control. So the top 3 things that they're loving with HealthEngine is that they can see your time slots, that it's much quicker than calling, and also that they can book after hours. So when I'm speaking with clients, I like to refer to this little recipe or formula, which I call the lifetime value formula. So it's making sure that people can discover you, whether it be on Google or on HealthEngine, the 2 main search engines, I guess, that people are turning to these days for healthcare. Then making sure that people can book instantly with you, and then also keeping touch points up. So whether it is clinical recalls or reminders or any surveys, or if you've got some email marketing that you need to do as well, making sure that you can have regular touch points as well with them to keep them coming back means that you're going to have a lifetime value with that patient. It's really important to note that when someone comes through the door, that they're not just there for that first transaction, that if you've done all of this, you're going to get much more out of them as well. So this is all great, but I hear a lot of people then say, okay, cool, well, how do I transition to this new healthcare world? How do I actually take this on? It's not as scary as you think, and HealthEngine is very much what I call the magic that just makes it happen. So that transition with the products that I'll walk you through soon will look like this. So this is a client that I absolutely adore, Wembley Medical Centre. And I popped in there not too long ago, and Dr. Abby Hollingworth, who you can see here on the right-hand side of the screen, she popped her head out to let me know that majority of her bookings were actually coming through online. And I said, that's fantastic. And she said, oh, you don't understand. They're coming through in the wee hours of the morning. I said, oh, wow. So Abby Hollingworth is a great example of a GP who has actually got interest in children's health, and most of her customers that come through are new mums that have got little ones crying in the wee hours of the morning, got temperatures rising, and they're not sure what to do. They're jumping onto the app and they're booking with Wembley Medical Centre, which they've favorited. They're booking whichever time is going to suit them during the day. For example, they might see that 8:15 a.m. in the morning is available, and they know that they're going to be able to book that then and there, and then go back to doing whatever else they're needing to do, and then get ready for first thing in the morning. They can see Abby. They don't have to wait for business hours. They don't have to wait in queue on the phone traffic jams. They can go straight in and see her, and Abby can sort her out. So this is what that sort of transition looks like, and Abby is usually booked quite far in advance these days because it's just become so popular for her patients to book online. So HealthEngine's got two groups of products. I like to say that they're management focused and marketing focused. So in this little section here, I'll just cover off which management tools we've got available for you. And then next I'll go through the marketing tools. So whichever business needs you've got at the moment, it's really important to note which ones will help you fill the missing pieces that you've got in your patient journey at the moment. So firstly, we've got the online booking system. So this is the booking calendar that sits on your website, and it allows patients to book 24/7 with you. It also frees up staff time so that there's no huge phone traffic jams in the mornings, and it means that you can fill your appointment book. It keeps visibility for your patients as well, especially if they're used to coming through to your website on a regular basis. So when do people book, and why would I need an online booking system? It's interesting that we've actually managed to look at all of our data and see that 57% of all health service bookings across all disciplines on healthengine.com.au are made outside the traditional business hours. So that's 9 till 5 p.m. So that's really important to know, so that when your lights are switched off, you're able to take appointments around the clock still. Another patient insight is, well, how often do they book? We've seen on average that the HealthEngine customer books 4.1 healthcare appointments each year. It's higher on the app, which is 5.8, which goes to show that people in that proactive mode in their healthcare are actually using the app more regularly because it's just at their fingertips. And I've got some dental clients that were a little bit hesitant in publishing appointments, purely down to the fact that they were like, well, I don't want to look like I'm not busy because then it might look like I'm not a very good practice. Our stats actually show quite the contrary, that patients are more inclined to book with people when they've got more availability. So I did a small snapshot in 2015, just a little 3-month snapshot, and saw that people that were publishing more than 150 appointments each month were receiving 8.8 times more bookings than those who are publishing much less. So the business gains for you are a lot higher if you're going to be able to put everything out there that's available. An example of this is I probably wouldn't go to, for example, this Garden City Smile Center and call them up and say, hey, I'm hoping that you've got a 3 o'clock appointment available. I'm probably going to see that, oh, this one over here to the left has got a 3 o'clock. Actually, they've got 3:30. That suits me even better. I'll book with them. So the patient journey is much different to how people are envisaging it. So it's important to make sure that all your appointments are available and up for grabs, and then that way you've got practitioners that aren't twiddling their thumbs during appointment slots and costing the business more money. So making sure you've got that availability means that patients can take that immediacy, which is what they're wanting. Another product that we've got available as well is recalls. So we've got it available for best practice and also Praxoft, which is about to launch officially on the 1st of July. And so this is an incredible product. It has got unlimited SMS capability, so you don't have to have any SMS credit bundles or anything like that. It helps you save on postage, printing, and stationery. It makes sure that you get a fast response from patients coming through to a method that they'd prefer rather than a method that they might have moved house and they don't receive those letters. Now you can actually contact patients in a way that they prefer. And also you can get bulk actions done. So you can do a whole lot of filtering so that you can go out to all patients that are requiring, for example, a pap smear recall and contact them in bulk. So you could contact, for example, 50 patients, which would normally take you an hour to get through. Now it takes you a minute to get through, which is incredible. One cool thing as well that comes through from the SMS recalls is that they can actually book with you instantly from that message. So they'll receive the recall and then they can click through to your online booking system and book the next available time that they'd like. We've got patient SMS reminders and what's called Practice Pager as well. So if your patients are needing to stay organized, we've got an SMS reminders product, and also just a little bit of a preview insight. This product is getting a massive relaunch next month. So if you'd like to learn about that, let me know and I'll put you on the exclusive list that you can learn about that before it goes public. The practice pager as well is if you are wanting to know when you've got an online booking that's come through. You might be on the go or out on the golf course if you're lucky enough, and you can get a notification to say that you've received a booking and that you'll probably need to go back to the practice at some point. Now this all comes together in our practice admin portal that we have for you. So you can see all the metrics available around your practice profile, all your bookings. You can manage recalls from in here. You can review all of your surveys, and also you can manage your profile and online booking system customizations here. You'll be able to see which products you have got active and which products are available to you that you might want to look into as well. So everything can be done in here, which is fantastic. And we do also have the support team on hand to guide you through anything as well. So this is basically giving you top analytics that you're really going to need to know so that you can manage your practice much easier. So those are the management tools, and now I'm going to go through the marketing ones, which is essentially patient attraction. So first off, we have the professional profile on healthengine.com.au and the HealthEngine app. So as I mentioned earlier, we actually have over 1 million unique users on HealthEngine each month, which is massive. It gives you a chance to compete so that patients have options in their area. And if you're new to the area or your patients are looking for you, they can find you there. It does improve your SEO as well. So the more that you're mentioned online, the better. And you can link back to your website as well. So if people are needing to research more about you, you can also send them back to your website for any reasons. And you can track everything. So as mentioned before, you've got the practice admin dashboard that you can go through and check out everything to do with your profile. So how many views you're getting, what people are clicking on, if they're going through to your social media, etc. You've got full visibility on everything. What's cool with the professional profile is that actually free with that, you get practitioner profiles. This is a great chance for your practitioners to educate patients so that they can help have a bit of a voice and kind of build some rapport with the patients so that they feel trustworthy and they gain confidence in their service. It's also really great for a recruiting tool. So making sure that your practice looks appealing for new doctors. This is one thing where you can say, look, we not only have marketing available to drive patients through, but we also make sure that you've got a really stunning profile so that patients can learn about you and link up with the practice this way. One of the mutual benefits as well is that if you've got a doctor, for example, that's moving to your practice and their loyal patients search for them specifically, they can search on HealthEngine for that practitioner and they'll be linked up with your practice. So it's a bit of a mutual benefit there. We also have ratings and reviews available. So this by default will be switched on. You can switch it off at any point if you need, but this is fantastic for that, making sure that people are getting confidence in your service, which is one of those top 3 things that you need to make sure you're ticking off for your patients. So you can actually have a star rating, and with your star ratings, you can earn the Patient's Choice Award, which you can see in this little magnifying glass here, which is that little golden tag. So the top 100 Australian practices will be awarded that by HealthEngine each year. And that's just a great way to help new patients that are looking to consider you just gain more confidence in your service, knowing that other patients would really recommend you. It also gives you notifications. So when you get a survey back from a patient, we'll send you both positive and negative reviews so that you can use that to help restructure or learn about your business. And then also only the positive reviews are published online as well. So we've got a quality check team at HealthEngine that are going through every review to make sure that only positive reviews are published on your profile. Next, we've got HealthEngine Patient Match. So the reason why this is called Patient Match is because it's matching new to your practice patients that are looking for your area and your services, and we're matching them with your practice and your services. So it's the perfect match, essentially. This is a pay-for-performance product. So gone are the myths that you pay for every patient that comes through from HealthEngine. Only new patients that we've introduced you to receive a match fee. And it's pretty small considering what your lifetime value and return on investment should be with that patient. You can turn it off if you want. All it's doing is publishing your appointments on healthengine.com.au and the HealthEngine app. So this is not the publishing appointments on your website, which is the online booking system. This is publishing them to HealthEngine users specifically. And the cool thing as well is you can cap it. So you've got complete control if you've got a set amount that you're budgeting towards new patients that come through from HealthEngine. You can cap it. The only downside to that is that once you've reached your limit that you're willing to pay, then your appointments won't show as soon as you've hit that on healthengine.com.au and the HealthEngine app. So existing patients as well can keep coming through here. And the cool thing as well is that once you've received a new patient, that the next time they book, obviously they're an existing patient and they've probably established that search behavior where they come through and do all of their bookings with you on HealthEngine. So it's a great way to retain people as well at no charge. Next, we have featured listings. So if you're really wanting to stand out and get a bit more out of your results, you can feature your listing in which postcodes you'd like to gain more patients from. So there's 3 positions available in each postcode. They're always pending availability, but if you've seen a postcode that seems to have all 3 slots taken, we can put you on the waiting list as well. So we did a little bit of a result check and saw that when people were using Patient Match and a featured listing, they actually received 8 times more bookings than those who didn't have featured listings, which is a really cool little snapshot. So yes, definitely recommend that if you're looking to get a bit more out of your results on HealthEngine. The next is that we've got Google AdWords available. So HealthEngine is a premier partner with Google, and we're the only one globally in healthcare specifically. The cool thing about that is that we only deal with healthcare keywords and we understand healthcare like nobody else. So you can target people on the top of Google searches when people are searching specifically for your services. And the unique benefit with HealthEngine is that you can close the loop. So you can see how many bookings you've generated from your campaign in your monthly reporting, and this links perfectly with your online booking system. You've got transparency as well, so you can see all your metrics, including your media spend, and you can also only pay for performance, which is fantastic. So you'll have a set budget each month, and as it's cost per click, pay per click, sorry, you're only paying for when the click happens, not for when you appear. It's important to note that 38% of people actually trust search results more than other channels, and that 44% are more likely to contact a business at the top of the results page. Even if they're not clicking on the advert, it very much strengthens the brand in the organic results as well. And 36% of people rarely ever go past the first page. So it's really important to check where you are and your competitors, doing a general search, say your services plus your location, and then see what's coming up so that you know whether this is an area that you really need to start being in top of. Again, I did a little snapshot in 2015 just to check how many bookings were coming through for people that had Google AdWords versus people that weren't using Google AdWords. And we saw that 3.6 more bookings came through for the people that were using Google AdWords, which is really important to know that it's great to have an online presence, but to make sure that you gain your own momentum around that is really important. So I very much recommend using a Google AdWords campaign to drive more patients through the door if that's an objective for your business. And the other attraction tool that we have is practice website builds. So if you've done your mobile search and seen that your website isn't mobile friendly, we have got an option for you as well to have a website built for you. And then the cool thing as well is that you can include your online booking system on this, and you can monetize every single page so that whenever searches are happening 24/7, you can receive bookings as well. So it's really important to make sure that people can find and book you. As you've known through this webinar, we've covered off all of that with patient insights. And now I really want you to as well just take note of what you're wanting your patients to do. Secondly, what you think they're going to need to be thinking in order to compel them. And 3, how are you going to compel them? So if you want them to know that you've got availability, how are you going to make them know that you're going to have availability? So publish your appointments, create adverts to say what hours you're open. And then 3, how are you going to do it? So which products are you going to look into to help fill those missing pieces for your patient journey at the moment? So just the 7-step recap for this webinar as well. It's really important to know that patients are in control in this new healthcare world, and they're very much proactive about their healthcare now. So we need to make sure that we can be there when those searches are happening. Competition is going to be extremely fierce, and there are going to be winners and losers. So you need to make sure you decide at this point which you would like to be and how you're going to compete. Thirdly, knowing what patients want. HealthEngine's top interest is patients and making sure that we're building products that they're needing so that we can make sure that practices are aligned with what patients are needing and they're going to be relevant for those searches. We also need you to focus on your own game. So be aware, yes, that there is competition out there, but make sure that you then look at what your strategy is in this next new financial year and look at the lifetime value of your patients. So making sure that you are discoverable, that you've got availability, and that you are able to connect with them on a regular basis with more touch points. Also make sure that you can find those missing pieces that patients are looking for at the moment. So if they're looking for your services on Google, can they find you? If they're searching for you on HealthEngine, can they find you? And if you have got availability at 2 o'clock today, do they know that? Making sure that you've got all bases covered is going to mean that you've got an airtight solution. And 6, making sure that you can transition. So sometimes taking that leap of faith and jumping to the next transition is a little bit scary, but making sure that you actually do implement those missing pieces is crucial so that you can start taking advantage of those searches happening now. And then finally, make sure that you test, measure, adjust, and repeat. So for example, with the websites that were built in the 90s, that's great that you had a website built, but now it's time to test it. Is it still working? Is it relevant? Does it work well? Is it easy to use? Make sure you test things, measure things, adjust them, and then repeat. So that's a wrap for the webinar this morning. Thanks so much for joining me.